If you've ever been in the hospital, you know that it's usually not much fun. You may have to take medicine that makes you feel lousy, have tests, and are no doubt a little anxious about being there. Doctors at Mayo Clinic are working on making the hospital experience easier for patients and their families. They've embarked on a study to see if art at the bedside improves hospital stays.
I'm miles away from home from Florida, and I know it's going to be about 100 days before we get back there.
But by painting images of home, giving them color and life, Karen Brennis can forget for a moment that she's in the hospital fighting a deadly disease.
I'm picturing it in my mind anyway.
Karen has multiple myeloma, a cancer of the blood for which she needed 2 bone marrow transplants.
I was here a whole month.
A month with little else to do than read, watch TV, and worry. Until today.
Start with lines and shapes, and just to kind of play with color.
Art educator Michelle Heidel guides patients interested in participating in the Art at the Bedside study.
Now I wish I were the best drawer in the world.
Oh, it doesn't matter.
What does matter, says Mayo Clinic Dr. Alexandra Wolanski and her research team, is finding out if the art experience reduces pain and anxiety and improves the mood of patients.
I think we all have heard of the mind-body connection, and this is just another way to tap into that, if you will.
It's a way of getting your mind off of the medicines and the needles and the tests.
A window to a world you create where some of the stresses of being in the hospital can be brushed away.
I think any diversion from laying in bed and thinking about just things that are happening to you is a good thing. I painted a tree, 2 trees, and a couple of birds in the tree. That was fun.
Karen says she's not an artist, but even doodling can help distract you from the worries of being in the hospital. And if patients are too sick to paint, they can simply watch the artist paint for them. Dr. Wolanski is hopeful that after the study's complete, they'll be able to offer other types of art, such as music and creative writing, to patients. This project is sponsored by the Mayo Clinic Center for Humanities and Medicine. For Medical Edge, I'm Vivian Williams.